Steve and I serve as co-leads of the Health Resources Task Group, a group working through a range of options for implementing a robust program of testing and contact tracing this fall. We will be recommending the highest possible levels of testing and contact tracing achievable, given factors such as available resources and fluctuating infection rates. No precedent exists to manage a pandemic on a university campus. Therefore, we are relying heavily on the data that are available, the guidance of our own faculty experts, and recommendations from health agencies such as the CDC to come up with ways to minimize risk to our Penn State and local communities and relieve the potential burden on our healthcare facilities.
Our group comprises of more than 30 highly qualified faculty and staff from a range of disciplines across units at the university. These include clinicians, scientists, engineers, IT and systems experts, and many more. The group has representation on behalf of the University Park campus and our medical school, as well as the Commonwealth campuses, and is directly connected to the other university COVID-19 task forces. Even within our own task force, there are currently 11 separate work streams operating in parallel and working on such things as testing strategies, including surveillance, sample collection, contact tracing, Commonwealth campus coordination, and technology. We meet frequently to evaluate the rapidly growing body of research on testing and contact tracing, with the ultimate goal of determining who we should test, when, where, and how often we should test, to what extent we should trace and test the contacts of COVID-19 positive individuals, the most effective contact tracing strategy across all Penn State campuses, how to best monitor capacity of our local healthcare systems, how we should present that information that we gain from these steps that are being taken, and how that information will provide insights for the university's leadership decision-making. We are, of course, planning to test all individuals who present with symptoms and to perform contact tracing to identify possible transmission of the virus to others. While we are exploring what we can do and should be done at Penn State, we certainly do not have all the answers to this unmatched healthcare crisis. However, the many options, along with the possible outcomes that we will soon put forward to the university leadership, do take into account the unique attributes of each of our campuses and the communities in which they're located, with particular attention being paid to the capacity of their local medical facilities. We expect to present a host of options to leadership in the very near future.
Testing and contact tracing are critical mitigation tools that the university can use to identify true cases and prevent further transmission of the virus by requiring positive individuals to quarantine or to isolate. But these mitigation strategies won't be effective without strict behavioral interventions, including wearing face masks, washing hands, avoiding large gatherings, and social distancing. The vast majority of faculty, staff, and student respondents to the recent Return to Campus surveys said they already practice mitigation efforts and will continue to do so on campus. Every one of us here at Penn State believes in the university's mission to help our young people grow into thoughtful, contributing members of society. We can carry out this mission and reduce risk if we all commit to practicing rigorous disease mitigation steps and implementing a comprehensive and flexible program of disease surveillance. This period of behind-the-scenes work with some of the university's best minds in medicine, disease, and logistics has been vital to remaining true to our commitment to put the health and safety of our community at the forefront of decisions. We have been moving purposefully and at the same time with caution, recognizing that there is an urgency to the process as well as a desire for details. Plans for return to campus will continue to evolve as we learn more and consider the many complex aspects of this public health crisis. As we move ahead, we remain committed to putting forth recommendations based upon the best available science and also in the best interest of the health and safety of our communities.